Hello, this is James Lowry with James Lowry Hypnotherapy, where I, with the help of a medical provider, aid adults suffering with immune disorders in relieving the emotional stress surrounding their discomfort in order to achieve a better quality of life in as little as one session. Today's frequently asked question is: are immune disorders curable? Now, before I answer that question, I want to make it abundantly clear that the information I am presenting is not to serve as a substitute for medical advice. My role as a hypnotherapist is to serve as an effective adjunct to those already receiving medical treatment who might need additional care. Are immune disorders curable? Currently, there is no regular, absolute, or sterilizing cure for an immune disorder, meaning the complete eradication of the disease process itself with no residual immune system abnormalities, no genetic predisposition leading to a possible relapse, and no risk of reoccurrence. However, there are functional cures, which is currently the closest definition one has to a true cure for an immune disorder. And this type of cure typically involves a holistic approach in the form of functional medicine. Now, what makes a functional cure as opposed to a regular, absolute, or sterilizing cure is the fact that the disease is still present, but there are no ongoing active symptoms for at least 12 months. And this, in and of itself, is not owing to any immunosuppressive medication. So, what type of functional medicine or holistic approach might result in a functional cure of this type? Well, functional medicine in this way looks to treat the underlying causations within one's mental, emotional, and physical health rather than the symptomatic expressions of the disease. Now, with all this being said, you might be wondering what might be the best approach within functional medicine for the treatment of my immune disorder. And my answer to that would be one that incorporates the principles within a branch of science known as psychoneuroimmunology, which studies how the mind, the psyche, one's neurology, and one's nervous and immune systems all interact with and affect one another. At the core of psychoneuroimmunology and its applications in the form of mind body therapies such as hypnotherapy is looking at where attention is placed, the degree to which attention is gathered and maintained, and the overall emotional quality or flavor of that attention. Mind body therapies such as hypnotherapy aim to therapeutically affect attention in this way to reestablish a healthy communication between one's mind, one's neurology, and one's nervous and immune systems. Now, you might be thinking to yourself, but James, I've tried talk therapies before and it didn't work for me. How is this different? Well, most therapies, and that of meditation even, aim to alter or bolster your conscious perception of the problem. But let me ask you something. If you could consciously decide right now not to have the discomfort you are experiencing, it would only be fair to say that you would consciously do so, would you not? If you could have consciously decided not to have taken on the discomfort at all, again, it would only be reasonable to assume that you would consciously have decided to do so by now. So the discomfort you are experiencing and the maladaptive psycho-emotional responses that surround it do not effectively exist in the conscious mind. Rather, they are most predominant in the unconscious mind. So if you're looking to adopt this kind of therapy in such a way that, with the help of a medical provider, aids you in relieving the emotional stress surrounding your discomfort in order to achieve a better quality of life in as little as one session, then give me a call or book a free consultation at James Lowry Hypnotherapy. I'm always happy to help.